Are we good?
Yes, go ahead.
All right. Good evening, everyone. I will now call to order the study session for Tuesday, April 27th, 2021 to order. We are convened as of 5:32 p.m. Mountain Daylight Time. I would respectfully ask everyone in the meeting to ensure that your phones are muted and that your ringers are set to silent. Directors and members of the staff, for the sake of the record, if you would like to be acknowledged during tonight's proceedings, I would ask that you please raise your virtual hand and wait for me to call you before proceeding to speak. Speaking out of turn will only add confusion to the record and to the proceedings. For any directors or staff participating by phone, please remember that you can indicate that you would like to speak by pressing *9 to toggle your mute setting on the phone, then press *6. As is our custom, I'm going to begin the meeting with a brief safety moment. Here are 5 reasons to still wear a face mask and social distance after you've been vaccinated. 1, it takes time for the vaccine to kick in. You will not reach the 90% plus effectiveness rate until 2 weeks after your second dose of the Pfizer or Moderna vaccine. For the Johnson & Johnson vaccine, you're considered fully vaccinated after 2 weeks only after your single shot. 2, the vaccines do not provide 100% protection. Although the vaccinations are incredibly effective, they only offer 94 to 95% protection. So there's no way to tell who the 5% will be who don't respond to the vaccine and will be at risk for COVID-19. 3, those of you who've been vaccinated might be asymptomatic spreaders. Experts are concerned that vaccinated people can still become infected without symptoms and then spread it to others who have not been vaccinated yet. 4, we still need to protect those with compromised immune systems and those who cannot be vaccinated. So even if you're fully vaccinated, it's recommended to steer clear of those considered high risk and those who are not vaccinated. And then there's 5. There are still limited doses of the vaccine, and there are more than 330 million people in the United States. Experts say that 50 to 80% of the population will need to be vaccinated to reach herd immunity, which could take us through the end of 2021 or beyond. Okay, so this evening, before I start, I'd like to do a roll call, and then I will go into this evening's agenda. Director Bouquet.
Present.
Director Broom.
Present.
Secretary of Music.
Here.
Director Kaplan.
Here.
Second Vice Chair Cook.
Here.
Director Davidson.
I am here.
Director Gichelle.
Here.
First Vice Chair Geisinger.
I'm here.
Director Lewis.
Present.
Director Rosenthal.
Present.
Director Sloan.
Here.
Director Tisdale.
Present.
Director Whitmore.
Present.
Director Williams.
Good evening. I am here.
And I am here. So we have all 15 board members present this evening. Tonight, we're going to be hearing a presentation from our General Manager and CEO, Deborah Johnson. This presentation is in regards to the road to recovery from the impacts of the COVID-19 pandemic on the agency's service and our finances. She will also be discussing a process called design thinking, which will lay the groundwork for our strategic planning efforts with the board. Now, following the presentation, the general manager will take questions and comments from the board. So without further ado, I'm going to turn it over to our general manager. Good evening, General Manager.
Good evening, Madam Chair, and good evening to all of you that are virtually assembled. Before I delve in, I just want to share that this will be an engaging process, and the elements of my presentation is just to orient you all on how our engagement will occur. I'd be remiss not to acknowledge I have invited our strategic planning partners to listen in. So we do have Mark Ash on the call with TransPro, as well as Aaron Bingaman, who is on the call as well, because quite naturally there's intersectionality with all of this. So I want to manage expectations as we go through this design thinking process, and we're learning to be empathetic and, defining what a problem is, recognizing we're not going to walk away tonight as a fait accompli. This is going to be iterative. So with that, I have my colleague, Pauletta Tanilis, who is going to actually help run the presentation tonight as we go through this. So if you're ready, Ms. Tanilis, you can pull up the presentation and we can get going. Alrighty, so thank you very kindly. And once again, good evening, Madam Chair, members of the board, and to all who are virtually assembled. I am Deborah Johnson, the General Manager and CEO of the Regional Transportation District. And this evening study session is centered upon RTD's Road to Recovery, basically the post-COVID-19 pandemic. And I'm looking forward to engaging with all of you and approaching our path forward by utilizing design thinking. Next slide, please. So the slide before you illustrates what I will cover to orient us to the design thinking process. Briefly, I will revisit our current status, then ask you to think about what recovery means from your respective vantage points. I will then introduce the design thinking process in a high-level fashion, and then put the first three phases of design thinking and process with all of you. That will be the basis of our engagement this evening. And lastly, round out with next steps. So as we all know, we remain in the midst of a global pandemic. Our service remains at 60% of what it was in early March of last year. Social distancing remains in effect, hence capacity limits on our vehicles remain, which is 15 customers per a 30-foot bus, 20 customers per a 40-foot bus, and 30 customers per rail car. While mask mandates have been lifted, for people while they're outdoors, masks must still be worn when waiting for or using public transit. My team and I are currently evaluating if we should move to 50% of seating capacity on board our vehicles for our impending service change in June. Recognizing some COVID protocols have been listed, as I just described, when I reported out last Tuesday at the board meeting as well during my general manager report, I am proceeding with caution, as the current 7-day case rate per 100,000 people within Denver as of 5 p.m. today is 186 cases per Denver Public Health and Environment's website. That is significantly above the stated level blue range of 36 to 100 cases per 100,000 people. While there has been numerous conversations about the decrease in COVID cases and increase in vaccination in recent weeks nationwide, two issues continue to vex Colorado public health officials: rising hospitalization, particularly among younger adults, and disproportionate percentages of Latinx and Black Coloradans who are not vaccinated. RTD does remain flexible, as Carissa and American Rescue Recovery Plan Act the funding has greatly supported our ability to deliver service by ensuring we can maintain our essential workforce. Next slide, please. Considering what I just shared, there is a great amount of ambiguity as relates to our immediate future. Recognizing a vast population of our Black and Brown communities are not getting vaccinated, the timing of herd immunity is unknown. Telework and on-campus instruction have impacted major activity centers, such as major employment sites in Denver Central Business District, the Denver Tech Center, the Anschutz Center in Aurora, as well as educational institutions in Denver and Boulder. We must ensure we maintain staffing levels to abide by social distancing protocols on board our buses and trains, While attrition is still continuing with retirements, separations, be they medical, voluntary, or non-voluntary, all are important factors to have top of mind. So I ask each of you to think about, what does it mean to recover? Is it going back to what we had pre-pandemic? Recognizing that life has changed, thus habits have changed, and doing business as unusual has become usual, i.e., we're all assembled right now virtually. Uber Eats probably has delivered a couple of your meals. So what is it? Is it volume? Should we deploy a level of service with the attitude they will come? Or should we think about the quality of service we are providing over the quantity of service? Is it equity? Recognizing that we have cumbersome fares that are hard to comprehend. We cannot continue to proceed with false expectations of leveraging pilot programs that sunset at 6 months when there has been no fair equity analysis conducted. The same applies to service in the terms of ensuring that minority populations and low-income populations are not disproportionately burdened and/or disparately impacted. Is it viable and seamless accessibility to activity centers 24 hours a day with 10 to 15-minute headways? Or is it greenhouse gas reductions whereby all people in the region benefit as the air is a little cleaner with less emissions? Now, with all that as a backdrop, let's move on to design thinking, which is a human-centered approach to innovation. Thinking like designers can transform the way organizations develop products, services, process, and strategy. This approach brings together what is desirable from a human point of view with what is technologically feasible and economically viable. The phrase design thinking describes the element of the practice found to be most learnable and teachable: empathy, optimism, iteration, creative confidence, experimentation, and an embrace of ambiguity and failure. It also allows people who are not trained as designers to use creative tools to address a vast range of challenges. Hence, my reason for using this process to address our road to recovery. So with that as a backdrop, I'd like to delve into the design thinking process, which is extremely useful in tackling complex problems that are ill-defined or unknown by understanding the human needs involved, by reframing the problem in human-centric ways, by creating many ideas and brainstorming sessions like what we endeavor to do this evening, and by adopting a hands-on approach in prototyping and testing. Now on the slide before you are the 5 stages of design thinking, but let's quickly explore each phase. If we can go to the next slide, please. So empathizing involves finding more about the area of concern through observing, engaging, and empathizing with people to understand their experiences and motivations, as well as immersing ourselves in the physical environment to gain a deeper personal understanding of the issues involved. Empathy is crucial to a human-centered design process such as design thinking, and empathy allows design thinkers to set aside their own assumptions about the world they know in order to gain insight into the users and their needs. So for us, we're talking about our customers. What are their pain points that we need to be empathetic to? Next slide, please. So to illustrate, as we look at defining the problem, instead of doing it in the sense of the problem as your need, let's use an example of a company that, say, wants to increase its food product market share among young teenage girls by 5%. So keeping in mind, we have a company, they want to increase food product market share among young teenage girls by 5%. Reframing and defining the problem in human-centric ways would lead to defining the problem as teenage girls need to eat nutritious food in order to thrive, be healthy, and grow. Next slide, please. In this stage, is where we have grown to understand our customers and their needs because we've empathized and we have analyzed and synthesized our observations in the defined stage and ended up with a human-centered problem statement. With this solid background, we can start to think outside the bus to identify new solutions to the problem statement we have created. And you can start to look for alternative ways of viewing the problem. Next slide, please. So prototyping, this is the experimental phase, and the aim is to identify the best possible solution for each of the problems identifying during the first 3 stages. The solutions are implemented within the prototypes, and one by one, they are investigated, either accepted, improved, and re-examined or rejected based on the customer's experiences. So by the end of this stage, the design team will have a better idea of the constraints inherent to our services and the problems that are present, and have a clear view of how real customers would behave and think and feel when interacting with our services. So the final stage, of course, in the 5-stage model is testing, but let's keep in mind this is an iterative process. The results generated during the testing phase are often used to redefine one or more problems and inform the understanding of the users, the conditions of use, how people think, behave, and feel, and to empathize. Even during this phase, alterations and refinements are made in order to rule out problem solutions and derive as a deep understanding of the services and customers' usage as possible. Now, I want to share that, recognizing I went through this quickly, there's 5 stages. It doesn't have to be, sequential. These can be happening in tandem as we go forward, and recognizing that I'm introducing this concept, and I do know design thinking can be challenging because basically we as human beings always want to rush to solve the problem when we may not actually know what we're solving for. So while I intend to utilize this process with all of you, I recognize that we're going to have to be flexible and agile and pivot. This isn't a fait accompli, as I said before, and recognizing as we delve into this, you all have constituents in which you represent. You all are users of our system. So I think tonight, if anything, we are trying to gather information because the end result ultimately is what it is that our customers need. And you've heard me say countless times, we have to go to where the people are. So whatever it is that we do discuss, it's going to be paramount that we go out and talk with our customers to ascertain, is this a pain point for you? And what can we do in being the providers of this service be better apt to serve your needs? Because we don't know what we don't know at this juncture, because there's so many different important factors. So with that, if you have any questions at this time, I'm more than happy to address those. But I want to be clear. I want to ensure that we have an opportunity to share ideas, understand the pain points that you want to bring forward. And as we go through this process, this isn't a one and done. We will be engaging. And as I shared before, with Transpo being on the call, as we work in earnest to discern what our success outcomes are, all of these different elements come into play. And what I find to be interesting, we were going to have this discussion back in March, recognizing that Transpro had yet to join us being partners, that sometimes things happen for a reason, and this is all coming full circle. So with that, I will yield the floor, Madam Chair, and see if any of our esteemed board members have any questions before we delve in and start with the empathizing stage. Thank you.
All right, thank you very much. If you would like to speak, please raise your virtual hand. I'm going to start with Director Deschelle.
Thank you, Madam Chair, and I apologize, I always have questions. But GMCEO Johnson, thank you so much. I am remiss that we won't be engaging in the infamous D-School gift-giving exercise. But my experience with design thinking has been that it's important that we sort of understand when we're seeking to empathize, we are such a large organization and would love some, and I imagine us going through this process in many different aspects of all of our operations. Would you mind, just for the purposes of tonight, where are we seeking to empathize? What are we applying this sort of design thinking to? or are we really intentionally keeping it broad?
Madam Chair, if I may,
Please.
Director Deschelle. So I had that question posed to me by another board member, and recognizing that I know we want to have a better understanding about the possibilities. I'm not being prescriptive. I do have something in mind, recognizing we have a myriad of different services. We have different customer segments, but for all intents and purposes, as we get to what we're trying to define and what that may be, it's basically starting here relative to what are our customer pain points, because once we can start with empathizing, that will in turn help us identify the problem for which we're trying to solve. Does that help you?
It does, yes, thank you. So actually, may I clarify? Because what I heard is this is really let's put it all out there and then iterate on each of those sort of subsequently.
Yes, sir. I would say that's fair.
Thank you.
All right. Director Davidson.
Yes, thank you, Chair. I will keep it quite simple. I just wanted to say thank you to CEO and General Manager Johnson. I have used design thinking for many years in the engineering realm and product realm. I think it is a fantastic framework for us to bring here. And Ms. Johnson, I just wanted to say thank you very much for bringing this to RTD. For what it's worth for fellow board members, I think this will be a fantastic experience. Thank you.
Thank you so much, Director Davidson. I appreciate your comments.
Director Lewis.
Thank you, Madam Chair. I actually have one comment and one question. The comment, well, actually I have two questions and a comment. The first comment is around the design thinking. I'm really, really excited about it. I'm especially excited about the 5 steps and more specifically the empathy, because I think there's really value in hearing the stories of those who utilize our services. And so really appreciate you, General Manager, bringing this conversation forward. The question I have for you with the design thinking is around regional equity, or regional empathy, or regionally this process. I think one of the things that I'm trying to figure out how we operationalize, or how it takes place in this conversation, is how do we ensure that we are looking at the region of transit and not just a specific area, and doing so in a way that's empathetic and equitable and all of those things. And so I just wonder at what point in this process, or how is that embedded in this process, that we are really staying global in our thinking throughout this process, and maybe not so micro.
So, Madam Chair, if I may.
Please.
So, Director Lewis, recognizing that we do have a very broad-ranging system and a service area in and of that itself, right? So recognizing that there's going to be different pain points for different customer segments, but I would surmise that we have similar customer segments throughout the district. We may have customers with disabilities. We have students in different aspects of our district. And so basically, in reference to talking about equity holistically, when we talk about those things, recognizing that we are about to embark on a fair study and equity analysis, that is done system-wide, because we have to look at the plethora of our service area when we are making decisions holistically, because it's that complement from which we use census data to inform ourselves. So I am looking through the lens from a holistic vantage point. There could be some aspect when we talk about service whereby micro transit may work better in some aspect of the district, where 60-foot articulated bus may work better in another aspect. So I believe that all of those will come out as we have conversations relative to going to where the people are and discerning what the needs are that the customers have, and then how we can be quick to pivot and address those by going through the prototyping, phases, and doing all those things. In addition to creating baselines with surveys, I think that will enable us to capture what it is that we're seeking to provide service on a regional basis. I hope that addresses your question.
It absolutely does, and it does so beautifully. So I really, really appreciate you taking the time to do that. And then this is going back to maybe one of the things you gave us an update on regarding the potentially moving to the 50% maximum passenger capacity. Is that something that we will have further discussions on?
Most definitely. So as I was sharing, and perhaps it didn't come across, recognizing that when we spoke last week, we are monitoring where we are and, recognizing that there are public health orders, that are spanning our district, but all of those public health departments are working in tandem. So what we're going to do is we're looking at these, and having just met with our Assistant General Manager and Chief Safety Officer earlier this afternoon, we have to ensure that this is not just some kind of, blip in reference to a trend line. We want to ensure that there's continuity. So recognizing there's a timeline set for, May 16th when health officials are looking at different protocols to be, modified. And then there's another line in the sand for June 16th. We in turn are doing that and are monitoring that closely. And I've made a commitment to you all. I will keep you apprised as I did at the last board meeting, and we will ensure that information is communicated out so you have an understanding for your constituents' understanding of what we're doing going forward.
Thank you so much. And I know that input of a myriad of stakeholders is important for you. And I guess I wonder how we might include operators in this conversation, because I wonder if there might be some routes, and maybe this is happening more often on some routes than others, that 50% might already be reached based on that 20% capacity from CDC. And so I hope that we might, while the data might be anecdotal, bring some of that into the conversation as we are consistently monitoring.
Well, thank you very much, Director Lewis. And I know Michael Ford and Fred Worthen and Dave Jensen are working in tandem, and they keep me apprised. And we do have communication forums. We work in tandem with our union. And basically, we do need to hear from our operators. We can look at all the data that we want, but they're actually on the front line to know what's happening on board their vehicles. So all of this comes into play as we make informed decisions to move forward.
Thank you so much.
Yes, and I was just going to say, I was just going to say, because quite naturally, we want to ensure that they're in a place where they're safe. And that's why I'm saying that there's great trepidation as we look forward to making any decisions, because we have to ensure that we have employees readily available to provide service, because keeping in mind, if somebody's exposed, if they don't contract COVID, we still have to quarantine them. Therefore, that means, we are down an operator or 2 or 3 or 4, and that impacts our ability to provide service as well. So that's top of mind.
Thank you so much. And that's all I have. Thank you, Madam Chair. Thank you, General Manager.
Thank you, Director Lewis. Second Vice Chair Cook.
Thank you, Madam Chair. Just a quick question, but I'll preface it by saying, when you run for office, it necessarily entails lots and lots of conversations. For me, there's nothing like it, knocking on doors or meeting people at forums or standing in front of the King Supers or whatever it might be. You engage people in ways that it's a singular experience. You otherwise wouldn't get that opportunity. And in some ways you get to empathize. But here's my question. When you talk customers, I want to clarify that for me, the universe of customers are people who are currently riding or people who want to ride, or maybe people who even could ride. Is that a fair characterization of finding our customers' pain points?
So thank you so much, Director Cook. That's a great question. When I use customers, I'm talking about active customers, because basically there could be 3. I use the 3 R's for me. I have, the 3 R's are, retaining customers, reclaiming customers, and recruiting customers. So I'm talking about the ones that we currently have. But on the flip side of that, we do have to ascertain why people aren't utilizing our system. And when I talk about going to where the people are, that's like going to an activity center, right? And what I qualify as activity centers, as I said before, they're major points of destination whereby there's a lot of activity. It could be an employment site, medical centers, shopping areas, and things of the like. And what I've done in past positions, do intercepts with those people and ask them, hey, here's a viable means of transport right here. Why is it that you didn't take public transportation? So getting back to your question specifically in the context that I'm talking about here, I'm talking about current customers, but as I said before, this is why we're having this dialogue. It's not prescriptive. So if we're talking about why people aren't utilizing our service and what we can do to attract them, then that's a pain point as well. So everything's out on the table, and I appreciate you posing that question.
Thank you.
Okay. I don't see anyone else in the queue. Does anyone else on the board have a question or a comment for the general manager? Please raise your virtual hand. General manager, I am not seeing anyone. You did a great job, but let me just say this. I was when you talked about holistic district-wide plans of action, I think for me that's huge in terms of the diversity in every single district that we represent. And particularly now that we're going into a census recount kind of stuff, it looks to me like we'll have some changes. I don't know what they will be. I'm just kind of thinking outside of the box. But could you talk a little bit more about your vision in terms of the district-wide vision?
So as it relates to a district-wide vision for me, I think it's imperative that there's several things that need to take place as I bring that to fruition, right? I think for anything, it is ensuring that people have access to our system. And part of that in and of itself is ensuring that they can afford to utilize the system. So recognizing that we're embarking upon this fair study and equity analysis, of which you guys will be getting information, as I promised, before the end of the month, that lays out our groundwork for that. It enables us to have a level playing field because we need to be working from a common set of facts. So as we go forward, trying to leverage, different fare structures that are of benefit to our diverse population within the region, that is something that I see being first and foremost. Because when we talk about accessibility, if you can't afford to utilize the system, it doesn't really matter how accessible it is, right? So that's something in and of itself. Quite naturally, with Transpro being on the call and with you all support and engaging them, we have to align around our North Star, recognizing what our success outcomes are, because I think that will enable us to work toward commonalities as relates to putting us on better footing. When I accepted this job and came into this organization, I knew that there was a lot of opportunity in leveraging engagement. And so that is first and foremost. As you all know, I say I'm a person in the people business, and we are people that make up this organization. And without people being within our district, there'd be no need for any of us because we wouldn't have people to transport. So for me, it is basically bridging those gaps. And by doing that, we have to understand how we're going to go about doing that holistically with my team in conjunction with you as a policy body, creating that alignment around what it is we're working toward, and then being able to communicate in such a way that people have an understanding of what the regional transportation district represents. So that's what I would qualify as my vision at this point in time, recognizing that by June, once we go through our collective exercises, that may morph some way. But I am flexible and agile as it relates to what it is that we need to do, because first and foremost, it's providing viable public transportation, because public transportation is the Great Society equalizer. And so that is something that is very imperative to me as we go forward in recognizing what we can do. And it's also a great economic generator as well.
Okay, thank you. I'll call again. Does anybody else have a comment or a question for our general manager?
Are we empathizing?
We're going to transition so we can do that. Just wanted to make sure that everybody, if they had questions before we got started.
Sorry.
Okay.
So I'm going to, if you can just bear with us for a moment, Pauletta's going to switch out the presentation so we can actually capture what's going on right now. So with that, Madam Chair, I will yield the floor back to you as we talk about empathizing and recognizing it's the human-centric approach in reference to understanding, people's pain points. And we're talking about the RTD system. So with that, I yield the floor to all of you, and let's see where your ideas rest as it relates to the empathy phase.
Well, I would like to start, if I could, because it's something I've been thinking a lot about. And one of the big issues is, for me, going to where the customers are. bus stops, parking rides, and talking to them. They're doing intercepts where they are gathering organically, waiting for our services to find out what the issues are. I think that that is a respectful way of engaging our patrons, so that they don't need to go out of their way because they are so busy working and making ends meet. Thank you. Secretary Busick.
Thanks, Madam Chair. And I'm, you'll have to forgive me because I'm not used to this process yet. So I might be on like the next step or something. So
That's okay.
We're flexible and agile. I recognize
Cool.
change is hard.
Good. So another thing I think can really be beneficial in terms of, your third R, you're recruiting new riders. The state legislature is giving us a prime opportunity for us to work with our TMOs who are working diligently on the ETRP legislation that's coming to fruition at some point in time. And I think RTD needs to be the ETRP solution for employers and work with TMOs and TMAs throughout the metro area who are working with the employers to see what they need. What are they needing? If they're going to have to reduce trip miles by their employees, they can do it a number of ways, right? They can do remote working, but there are a lot of jobs that require people to be there. And what do you do about those people? How do you reduce their trip miles? Put them on a bus, put them on a train. So I think it's a great opportunity for us, and the legislature is handing it to us. So.
Okay, so if I can, Director Busick, so and like I said, this will be organic. I know design thinking is new for people, and I think these are great suggestions as we go forward. So really working with the TMOs as we look to be a solution because they're representing so many different employers and so forth, correct?
Right, correct.
Okay. And so we can understand what our customer needs are through the TMOs because people going to work are actually utilizing our services.
Absolutely, you bet. Thanks.
Madam Chair, you're on mute.
Oh, sorry, thank you. And then I would just add that the TMOs have direct relationships with those businesses. And so they have a grassroots connection there. Director Rosenthal, I see you next.
Thank you. Actually, Madam Chair, to build on kind of what you said, and you had mentioned sort of like, making sure that we're picking people up at like bus stops, park and rides and things like that, garages. And just to build on that I think what people are wanting is door to door. So, if I'm leaving my condo going out to East Jefferson and saying, okay, I'm going to get in like say, a metro taxi or an Uber or a flex ride, and then go, door to door, or at least as seamless as possible, as fast as possible, as cheap as possible. So I think people are looking for that convenience. They're looking for, how do we make sure it's fast, cheap, and with the least amount of exchanges and transfers.
Okay, if I may, so Director Rosenthal, so when you're talking about bus stops, parking rides, door to door, and I'm going to ask these questions if you guys don't mind since we're engaging, recognizing you've talked to your customers, is this what they're saying? I'm just trying to get a feel as we go forward.
I think it's more folks that I work with, particularly, who are saying, look, they would take RTD more, but it just doesn't go as quickly or to where they want to go.
Okay. Thank you so much. That's what I was trying to figure out because oftentimes that's what it is, right? And as we leverage different, applications, the team has done a great job with that. But hey, if I can get Uber quicker than I can wait for a bus and it doesn't get me where I need to go, then how can we look at that and modify somewhat and understand that pain point? So thank you, sir.
Right. Thank you.
Thank you. Next, I see Director Williams.
Thank you, Madam Chair. I think that we need to listen to the viewpoints of our constituents, even if we don't agree with them. And I'm going to give you a quick example. The other day, I spent some time in Union Station and in the bus concourse with one of my constituents. I did not view it as an uncomfortable place to be or see anything wrong, but my constituent had a different viewpoint. And so I needed to go there and hear how she felt about it, even though it wasn't the same that I felt about it. So I think that we need to be open to stuff, even if it doesn't appear to be justifiable to us. That's still how people who are riding us feel.
Thank you, Director Williams. You nailed it. That's the whole design thinking process, right? Understanding what our customers' viewpoints are and being able to adapt to that. So thank you, ma'am.
You are welcome.
Okay, thank you, Director Williams. I have Director Deschelle next.
Thank you, Madam Chair. I want to empathize with our customers' frustration, and this is something that I see and have seen for the past few years as I use both the Zero primarily and the FF1 and FF2, which is that individuals are frustrated when they get onto the bus and this is observed and do not know where it's going or how much it costs.
Mm-hmm.
All right.
Thank you.
Director Davidson.
Yes, thank you, Madam Chair. I just wanted to, I guess we'll start with a question for Ms. Johnson. You mentioned customer segments. Have we gone through an exercise, listing out all of our customer segments so we can categorize problems, voice of customer, those types of things? Have we gone through that exercise?
No, we have not, Director Davidson. While we do have information pertaining to that, our team, we were just having a discussion, gosh, was it yesterday, Tuesday? Yesterday, as it relates to creating that baseline so we have an understanding of what that is.
Okay, great. Yeah, I think it would be really interesting to, start from and look at a list of our customer segments and kind of seek to get the voice of the customer from each of those segments. One thing that certainly occurs to me, especially being in the region that I happen to be up here, is certainly one segment is, as you mentioned, Ms. Johnson, those who are traveling to activity centers. And, hospitals and healthcare facilities are certainly one that are top of mind, I think, for all of us this past year, be them patients or employees. One question I have, and I believe, Ms. Johnson, you alluded to it earlier, is why are people not riding at those centers? In many of those activity centers, we retain riders throughout this awful year. And, I don't know what the percentage is. Do we have 10%, 20% of folks at those activity centers? How might we be able to increase percentages in kind of those specific customer segments? And that's one question that I would have that comes to mind is going to those types of places, call it a hospital, and interviewing folks who ride and interviewing folks who do not, and seeking to understand how we might be able to solve problems for additional customers. So anyway, I thought I would just kind of hone in on that since, Ms. Johnson, I heard you allude to that. It's an intriguing question given some of the centers certainly in the area that I'm in. And then again, I think the customer segment question would be an interesting one to start from.
Thank you very much, Director Davidson. And I think that basically has a clear-cut nexus to what Secretary Busick said when we're talking about working with the TMOs and what's happening at the state level, because recognizing that a lot of those large activity centers are leveraging the support of the transportation management organizations and agencies. So yes, thank you very much for that. I think that's a prime example of what this is all about here as we discern how we could best provide services to those individuals and understanding why they may not be riding because it's not convenient or we're not going to where they need to go relative to their places of residence and so forth.
Thank you.
Thank you.
Next, I have second Vice Chair Cook.
Thank you, Madam Chair. So, Deborah, you asked a really important question, it seems like to me, at the very beginning of the presentation, and that was, what is recovery? And I think, the implication is it even realistic or desirable to go back to what was sort of the norm pre-pandemic? And to me, it seems like with all that's happening, the likely changes, what's happening nationally and statewide. It's more the charge we have now is in looking at what we do, leaping into the future beyond the pandemic. And you know, just this week, the Biden administration set the new standards for greenhouse gas emissions. So I'm going to offer this as kind of a prequel to what Vince Busick had suggested. And that is, you know, here I'm quoting from Vox. It's an ambitious target that would require sweeping changes across US society. It goes on to talk about, you know, necessary changes in behavior. And so in thinking about that future, and the people in the region who, you know, all of our customers, potential customers who are now being, you know, they have a sweeping mandate to change their behaviors, their habits. If they're riding with us, they may be compelled to ride more if they're not riders. So I'd like to, in empathy fashion, focus on what that's going to mean for people, that dramatic change. How do we get a handle on that? And yes, work with our TMAs and other partners to do that. The people who are in touch, you know, engage them, take advantage of their touch points, and find out what that's going to be like and how we can be part of that solution. So, thank you.
Thank
Thank
you.
you. First Vice Chair Geisinger.
Thank you. I agree with what Director Cook was saying. I think that's all good thoughts. And in terms of sort of empathizing with our customer segments, you know, two that come to mind to me are certainly the ones we've been serving, our low-income, transit-dependent, essential workers, you know, that people for whom paying the bus fare is a big commitment. And so I think we need to be thinking about the pain points for people in that situation, in those situations. And sort of maybe a different customer segment is that I'm hearing increasingly just in the last maybe 4 weeks, 2 or 3 weeks, from people for whom they're starting to go back to work, or, you know, they can't get to work where our buses are starting later than they used to, or they're not going to the same areas, because that's becoming a big source of frustration and something that I think we need to address.
Thank you. Director Catlin.
Thank you, Madam Chair. I appreciated Director Busick's comments regarding the TMAs and TMOs, but there are segments of our overall district that are not represented by such an organization, or maybe it's one that's starting up. And I guess I would really like to acknowledge the frustration, similar to what Director Geisinger said, about those abandoned customers. There are a number of them who were abandoned with service pets and are waiting with frustration to see if and when there may be a reinstatement for service that they had counted on as they're going back to work. That's what I'm kind of hearing. So it's just an acknowledgement that many people have been just left out. Thank you.
Thank you. Director Bouquet.
Thank you, Madam Chair. How am I coming through internet-wise? Okay, good. There's a storm down here in Lone Tree, and I might have needed to call on Director Lewis's help, so I appreciate that it's coming clearly. I just wanted to make just kind of 2 points. My curiosity, just as myself starting out as a choice rider with RTD, was kind of having empathy for potential future riders, and then choice riders, and then of course our current ridership regarding ease of access of using RTD, as well as, you know, how much information do we need to know in actually finding what is the right ride for an individual? How much can an individual advocate for themselves based on the information resources we have? And then Director Lewis brought it up earlier, but I did want to make sure that we have it down on paper that empathizing for our employees and our operators, I think, is also very key, since those are both are lifelines. So thank you.
So Director Bouquet, when you use the term choice, you're talking about the discretionary customer, those that have other options that choose to utilize the system when they have other options readily available, correct?
Yes,
Okay.
correct. So I mean, I'm just coming at it from a lens of a very suburban district in which many people will choose to drive their cars. But you know, if they have the option, how can we make it as an ease for potential riders to actually use RTD? That would just be my comment. Thank you.
Thank you. Director Lewis.
Thank you, Madam Chair. I have a few comments as regards to empathizing, and what comes to mind for engaging and empathizing for me is understanding their experiences and their motivations while also immersing ourselves in their physical environment. And I said that I think Director Rivera Malpiedi mentioned going to where the folks are, and I wholeheartedly support that, and I love it. And this aspect of storytelling, right? Like the opportunity to hear the stories of the individuals who are utilizing our services or who would like to utilize our services so that we can truly understand what the problems are and the frustrations are that might exist. And to take that one step further to really share in their cultures and their cultural aspects in ways that I don't know we've done, in ways that I think would be beneficial. And so I don't think about us just going to I think in addition to us going to bus stops and going to parking rides, but also like, are there community hubs or events where people might gather, where we might be able to go to them? And it's not just an RTD event, but we're co-creating and collaborating with other agencies as well. So you might be able to like grab a vaccine or buy a piece of art from someone in the community, or learn about a daycare center in the community, or different resources. And so those are the things that I'm thinking about in terms of empathizing, is really immersing ourselves in their environments as well, and immersing ourselves in their cultures so that we can begin to encourage that ridership.
All right, thank you so much, Director Lewis.
Thank you.
Madam General Manager, that is all that's in the queue under empathy. I think we can go now into ideate. Is it ideate? Am I saying that correctly?
Ideate.
No, ideate. And now it's really defining the problem. So recognizing that we have all of this. So looking at what the problem is in humanistic terms. Now, while we do have these aspects up that some relate to empathy and some talk about how we can garner a better understanding of our customer pain points, recognizing I said we can be flexible and agile, I do want to reflect on some of the comments that were raised, because I think they were very spot on in relationship about the opportunities for us as we go forward to discern how we would travel forward. No pun intended with the traveling forward, but recognizing that we need to figure out how we can understand our customer segments. I am basically flexible where we could try here to define what we believe the problem is. We have yet to garner a true understanding of what the pain points are, but I think we have some steps that we can take to ensure that we are engaging with our customers to better ascertain what those might be. So I leave it to all of you. We can try to jump ahead, recognizing that we are doing this in an organic fashion to define what we believe the problem is based upon some of the elements that really come from the empathetic vantage point. Like I heard, for instance, people are frustrated by the abandoned service that they have, right? We heard that came from Director Catlin, and then we heard also that basically there is this whole need to leverage a different means of mobility due to the fact that our buses or trains may not address the needs of where people need to go. So they're utilizing, ride hailing companies and things along those lines. So I throw that out to see what the pleasure is, because we can go to this phase, recognizing that we're going to have to double back. And this could be an ongoing process as we tie it in with our strategic planning. And as we being the team, the senior leadership team can leverage some of these aspects of creating a baseline, so we're working from a common set of facts. Does that make sense, what I said?
It does.
Okay,
Yes.
cool. All right.
Thank you.
Feels like
All
I'm
right.
rambling.
No, I don't think so. I mean, I think this is great organic discussion. Before I start calling on the board members who are raising their hands, I would like to start with the whole idea of people feeling frustrated because there may not be a bus that goes to where they need to go to. And so I think it is very crucial for us to think about first, last mile connections and partnerships with other organizations that have shuttles or something to connect people, bike libraries, electric bike libraries, as well as Uber and Lyft rides. I think we need to have a suite of services available so that people can access them. And with that, I'll turn it to Director Williams.
Thank you, Madam Chair. I want to go someplace completely different. I want to point out for some of my peers here who teach that if you go to school, you get sex education and you get math education and you get basketball class and gym. How come we don't do a travel training program for kids in a school? How come we don't grow up future riders? I'd like to see us partner with every school district around to encourage kids who are very, very climate aware that transit is part of that awareness. Thanks.
Thank you. Director Rosenthal.
Thank you, Madam Chair. And so I guess as I'm also trying to rethink this and look at each of our current customers, you know, the real core of who we are right now, and as we try to attract people back to RTD, they're sort of like our business travelers, you know, that on an airplane. They are the people who really make up the airplane's core business. They make up our core business. And we need to treat them like gold and understand what makes them all tick, which is exactly why we're doing this. But I think if we drill down, you know, I think it was Director Deschelle that talked about, well, you know, is there like a map of the network, you know, something like what we have on our trains. But so building on that concept, like, so, you know, so like people who are maybe disabled or who are in a wheelchair or what have you, like if there's snow piled up next to a bus stop, they may not be able to get, you know, onto the bus, or somebody who's visually impaired, or you know, or if it's really cold outside, you know, the fact, or raining like it is now, you know, making sure that we are paying, you know, real close attention to each individual. You know, so like with airplanes, we have frequent traveler miles, you know, we have like a number, you know, and maybe certain people would like to sign on like a frequent traveler with RTD. And so that way we know exactly what their preferences are. So like when I go in to get my haircut, which isn't a lot, because I don't have a lot to cut, but when I do, they always know that it's a 1.5 and a 2.5, like wherever I go. And so what about wherever some of our riders go? Maybe they want to participate in a program where we know their preferences. I don't know, I'm just kind of throwing it out there to where how do we customize, you know, even better for some of our most frequent riders.
So Director Rosenthal, actually, that is a common practice with some systems. It's the loyalty programs, gamification as you go forward, because basically you want to entice people to ride. It gets back to what Director Bouquet was talking about when he referenced the discretionary customer, right? For those people that have other options, I may choose to do something else because I know there's something in it in the long run. And then basically I can be a promoter of the system and I can encourage my other friends to come along as well. And to Director Williams' point about travel training, I mean, having worked in different organizations, yeah, you start them when they're young, they stay in the area, they matriculate, go on to, you know, university level, then they get a job and it's something that they know. And I know a couple of you that I spoke with, like Director Bouquet and Director Deschelle told me about when they were going to school, how they utilized the system, and now they're on the board. So I think there's great merit in reference to what we're all saying here as we go forward, because these things we can basically look at in detail and come back and leverage this going forward. And this gets back, and I know, as I said before with design thinking, that you can move around with the different phases of this, but some of these elements could be prototyped, right? And we test and we see what works as we go forward. So thank you very much for that.
Thank you. Does that, are those all your questions, Director Rosenthal?
Yes.
Okay, thank you. Before I call on the next board member, I just want to remind the board that we currently have a 70% discount for students up through the age of 19 and free up to the age of 5 with a fair paying adult. Director Deschelle, you're next.
Thank you. And this is actually a request, and I apologize. I know General Manager and CEO Johnson, you do not want this process to be prescriptive, but in the interest of trying to give as much fidelity as we can to the design thinking process, would you mind, or maybe it's Pauletta, whoever is controlling, sort of walking us through the example that you gave from empathize to define, just so we can see those sentence steps and sort of see the thinking that we're trying to do? Because what I have been hearing is a lot of pointing out of problems and solutions, which I think is great. But I want to make sure that we're really giving fidelity, really approaching the design process with fidelity. And that would certainly be helpful to me and hopefully helpful to other directors as well.
General Manager?
Yes, so basically, Ms. Tanelis, if we can go back to slide, there you have it. So empathize, as we talk about, it's understanding the human needs. And as I said before, and thank you very much, Director Deschelle, recognizing that this is a new concept, and some board members have said that. I've been flexible with this because I'm not trying to be prescriptive in that regard. But one thing that I want to share is that a lot of things have come out of this because I wanted to ensure that you all as board members had an opportunity to share your ideas and viewpoints. And what I think, or what I know, let me qualify it as such, with all this information that we have, that my team and I can double back in a finite type of way and basically take the temperature in the sense of getting some validation with facts as relates to what it is by going out and engaging with customers and doing it in such a way that we have an understanding of where we need to go. And you know, and I want to ask, since we have Mark Ash and Aaron Bingaman on the call, recognizing that we're working on strategic planning, this is something that we could utilize their help with in reference to their experience in the industry. So Mr. Ash or Mr. Bingaman, would you like to weigh in on what I just sort of, you know, put you on the hook for in reference to working with us?
Sure, happy to, General Manager. Appreciate your pulling in and really insightful. If you watched us scribbling notes here, you'd see an entire book full of notes from what the directors have shared. I think that we'll be able to really introduce national conversations that are taking place. We have the privilege to be able to work with a number of your peer agencies on a national basis. And I think the structure, General Manager, that you put in place for this conversation, tailored with the unique insights that each of the board members have brought from their unique perspectives, is really setting up beautifully for a statistically valid introduction of both your customer's perspective as well as the community's perspective, which will very much inform the strategic planning process.
Thank you so much, Mr. Ash. Appreciate that. So Director Deschelle, with that as the backdrop, recognizing where we are, I just wanted to share that we can pivot easily. And, you know, as we go forward, we can be a little agile with this. And I know that some understand design thinking, it's new for others, but we can morph this as we go forward. So thank you very much.
Got it. And if I may, to sort of put a finer point on defining the problem, and I think this has sort of been said in a roundabout way, but it's that we don't properly hear the community's needs, and we're not meeting the community where they are. That would be, in my mind, what I've certainly heard and what I've experienced is that, or maybe we don't listen to the community's needs, but really the other part is that we do not meet the community where they are. And that is how I would help define the problem.
Thank you so much, Director Deschelle, and I thank you for that because that's one thing that I clearly heard when I was coming into the organization. So thank you, sir.
Director Deschelle, did you get everything that you needed? So,
yes.
Okay, great. Secretary Busick.
Thanks, Madam Chair. Comment Director Rosenthal brought up alluded to the airline industry, and just as an aside, it kind of makes me wonder why people are comfortable getting into a metal tube 200 at a time, sitting shoulder to shoulder for 3 or 4 hours, but they don't want to get on a bus. I don't think it's the COVID stuff anymore. I think there are other issues. But anyway, I really like what Director Williams said about kids and helping them to become climate aware. And I think a lot of our riders and potential riders are people that are climate aware. And I know a number of us on this board have stressed constantly, congestion relief, greenhouse gas reduction, and things like that. I mean, RTD needs to be the sustainability option. We need to push that and drive that faster than we drive our buses and trains, because just like the ETRP, we're getting a lot of things coming down the pike with regard to greenhouse gas emission reduction, and we can be the solution for that too. So I might be in the wrong place, and I apologize if I am, but
You're fine. You're fine.
thanks.
Thank you. Director Tisdale.
Thank you very much, Madam Chair. To repeat Director Bouquet's question, can you hear me okay?
Yes.
Okay, thank you. One question that I have as we look at defining the problem is, how can we appropriately or adequately define the problem before we actually go through the empathy process? The description in the empathy process was to understand the customer's needs. And that, I believe, is an important part of defining the problem. If we begin defining the problem before we've gone through that empathy stage, we might be solving a problem that we see, but we might not be solving a problem that the customer sees. And so I liked the idea very much that Director Williams suggested relative to targeting students for transportation training. But it seems to me that that could include in that transportation training, in effect, a survey of what students think about transportation and why they use it or why they don't. Because as you have pointed out, Madam Chair, there's a 70% discount. So that's a big deal to incentivize them to ride. I also liked very much Director Lewis's suggestion that for the empathy stage, we actually go out to places where people are gathering. The problem I have found with trying to talk to people at bus stops and at train stops, because I've done that several times, is that they're in a hurry. When they get off the train, they just want to get out. So you're not going to be able to talk to them. When they are waiting for a train, it depends upon how much time there is. Now, you might be able to gather several people, and I applaud Director Williams for going down to the Union Station bus concourse and talking to people there, because again, you might have more of an opportunity to get a little more time out of them. But it's a real restriction in terms of getting opinions, and that's why Director Lewis's suggestion about going to other gatherings and co-creating with others those gatherings might give us a better opportunity for truly creating an empathetic environment and being able to empathize with the problems that they state. There's more to say, but I'll stop there. I've gone on too long. I've already got like 6 lines of text there, so I'll stop. Thank you.
Thank you. Thank you, Director Tisdale. Before I go to Director Whitmore, I would just like to clarify that my statement about going to bus stops works. When you take an urn of hot coffee and an urn of hot chocolate early in the morning with donuts, people will stop and talk to you. Not only that, you have people standing with a survey asking them questions so they don't have to write anything. It's very, very customer oriented. So I understand what you're saying, but I think there are ways to accommodate their needs rather than us just assuming that they'll stop by and talk to us. So I think there's a lot of stuff we can do. Director Whitmore.
Good evening, Madam Chair and all. So I risk bringing this up because it might fit right into what Director Tisdale said, an assumed problem. Perhaps we need to know more about that. But when I think a little bit about my district and the choice riders, I think there is an intimidation factor by complicated fare structure, and it is easy to just get in your car if you're somebody that has that choice, as opposed to taking the time to learn, figure it out, whatever the case may be. You know, and that was kind of brought up off and on during accountability committees. I think it was part of the testimony today by one of the folks on the accountability committee that testified in regard to complex or confusing fares. Is this really a problem? Maybe it's just a select group of folks that are just too lazy to learn it and don't care about, you know, the greenhouse gas issue or have a nice car to drive. But I guess I'm curious if that really is a problem or not. I think many of us have assumed that. Maybe that's risky. But that's all.
Thank you, Director Whitmore. Director Catlin.
Thank you, Madam Chair. And I'm not sure if this is in the right spot or not, but it occurred to me in the empathy slide, the very last bullet, that one of the, some of the community that we are overlooking are the general taxpayers, and as well as the legislature. And we're kind of talking inside baseball and focusing, as we should, on our customers that are transit, but the taxpayers want to make sure that they're getting a good return on their investment, on the tax dollars that they entrust with this district. And I think they want to make sure that we're being good stewards of their contribution to this agency, and that we are getting a good return on investment. So I again, I don't know where that is, but that's a pain point among a lot of the general population. They're out there as well. It'd be lovely to turn many of them into choice riders, but first we have to demonstrate that. Yeah. Okay. Director Catlin, I'm having a hard time hearing you. I'm sorry. Is this better? Much better. Thank you. I was too far away, but generally, I just wanted to make sure that we put the taxpayers into the equation, and that they can be reassured that they're getting a good return on their investment. Okay, Pauletta, did you get that? Okay, I'm gonna assume she did.
Sorry about that. Yeah, I've tried to unmute. I got some of it. We can always follow up with you, Director Catlin, too, if I'm not capturing all. It was going in and out a little bit.
I apologize.
That's okay, thank you. Any other comments, Director Catlin? No. Okay, thank you. Director Lewis.
Thank you, Madam Chair. I thought you were going to Director Rosenthal. Thank you. So I really appreciate this conversation and this dialogue, and agree with many of the comments that folks have already shared. And I will say that the things that I have to contribute probably fit under safe, reliable, frequent, and cost-effective service. And so you can, you know, categorize them as you may, but some of the things that I've heard from my constituents is that we criminalize poverty. I mean, when I say that, this relates directly to fares and how fares are collected. And if folks don't have the $3 at this point to be able to utilize our services, then they typically need a warning, and which can escalate all the way into a warrant and then being kicked off of our services. And so I'd like for us to define that as a problem. I would also like to take the opportunity to talk about access in terms of language. We tend to provide our collateral and even our communication in English and sometimes Spanish, but really thinking outside of those languages to see if we might be able to expand to even providing a myriad of language access. I think Director Whitmore mentioned the complexity of our FAIR programs and our passes. And I will say that's true for our customers, but also true for our operators with keeping up with the monthly passes and the different color changes and the LIVE program or the youth discounts or the senior discounts. I've also heard that our wayfinding can be confusing and it's not really intuitive as it may be in other cities. And so I think there's an opportunity there. And then armed security in terms of safety, right? Armed security for some is safety, and the lack of armed security for others is the lack of safety. And so really figuring out how we define safety within our region and for different communities. And then finally, Director Tisdale, I wanted to let you know, when I worked at the Regional Transportation District, when the University of Colorado A-Line was coming on set, there were a lot of changes to routes that were happening because of the opening of the University of Colorado A-Line. And we actually went out and we did these events in different communities called Know Your Routes. When we were on buses and trains and, well, mostly buses, forgive me, when we were on buses and at bus stops and at parking rides, we would actually give them the information in collateral form and tell them that they can learn more if they attended these 4 events. And so they had a number of events in which they could choose from, and we work in partnership with the community hubs to get folks there, but also to offer things that they needed. So there are ways in which you can offer, and there are ways in which you can execute on it, but I do agree that it can be kind of difficult to give folks a lot of information in a short time, but you can give them some information quickly and tell them where they can go to find additional information if that's online or in person. That concludes my remarks. Thank you.
Thank you, Director Lewis. Second Vice Chair Cook.
Yeah, thank you, Madam Chair. And it seems like a problem statement in the form that design thinking that your example gave earlier. In order to thrive in our region, people will need to have a lot of options for getting around that aren't just using an SOV or that do not emit as much in the way of greenhouse gas. So I would say that's a problem statement that maybe we are a facilitator of options, or maybe we provide that service, or maybe we partner with others to help address it. But I think focusing on that need for people to have readily accessible and sort of customized options for getting around beyond just an SOV would be a problem statement.
Thank you. All right. Director Rosenthal.
Thank you. I know this is my third bite at the apple here, so my apologies to my fellow directors for talking so much. But I'm really kind of building on what everybody's saying, and I know we could probably talk to all the different riders and different types of people who do take RTD. But I'd like to mention our bicyclists, and I do follow them quite closely. What they're talking about on Twitter and their what they're doing in the community. I'm not a bicyclist because I'm not very good on 2 wheels, but I can say that they are looking for better routes, particularly on bicycle lanes, things like that. But then I also see how do we interface with our bicycle friends. Sometimes I see how they put their bicycles in front of our buses and things like that, or come on our trains. Are we as good as we can be to our bicycle friends? And so are we allowing them to board our buses, put on their bicycles to get where they need to go with the least amount of hassle?
All right, thank you. And before I go to First Vice Chair Geisinger, I will say, as a TMA director I've partnered with RTD on bike shelters at some park and rides. And I know the Commuting Solutions has as well. So RTD has been doing a great job of implementing RTD and biking, which I think is an exciting component for us to build on since this is such a great bicycle community as well. First Vice Chair Geisinger.
Thank you, Chair. I agree with a lot of what's been said. I think there are a lot of good ideas, and I think for me, some of the ones that rise to the top are the need to really be listening, and that's to our customers, that's to our operators, it's to our stakeholder partners, you know, and the local governments and TMAs and other groups. And I know General Manager Johnson has heard this many times that that's an area we can grow in, and I think we are growing in. So I would support that. And then the idea that Director Rosenthal put out earlier, and I think the bicycling is just one example of it, is the focus on customizing. How do we look at the problems people are facing? And this gets back to the price of the fares and the service and bicycling and a lot of different things, and try to answer some of these questions specifically. Thanks.
Thank you. Director Bouquet.
Thank you, Madam Chair. Am I coming in okay?
Yes, you are.
Thank you. Appreciate it. So I just kind of wanted to bring up, and this could be a little meta for lack of a better term, but I would just want to bring up, maybe the issue is when we are defining the issue, you know, we say at RTD, we are here to listen. I think it also would be important to say here at RTD, we're also here to act. We want to make sure that we as a board are taking, you know, feedback in, and it just doesn't go into some box that is never going to be used again. You know, we need to be genuine in the process of, you know, what questions we ask. And I think that's a huge part of it is, you know, if I'm the average day rider, I'm the average day operator, I'm around RTD all day. It's one thing, you know, to ask my perspective, to get my feedback. It's a whole nother step to actually go forward with that action and actually utilize that feedback. So I think that would be something important to just bring up is, are we genuine through this process? Are we actually going to take action from these?
Director Bouquet, may I ask a follow-up to what you're saying?
Yes, absolutely.
Yes. So basically, when you said we want to be genuine, so recognizing that we could get some feedback that's good feedback, but there could be some reason why that we didn't leverage it. So if we have a feedback loop and explain, I just wanted to be able to clearly understand what you're saying in the sense of being highly communicative, so we can circle back so people understand it didn't fall into a black hole. Is that what you're saying ultimately?
Yeah. Sorry if I didn't articulate that.
Yeah.
Okay. But yeah, that's what I ultimately would see. You know, if I'm the average day rider, if I'm the average day operator, is what I'm saying actually being evaluated? Okay. Is it fair? That's actually put into play? Yes.
Okay. Thank you, sir. I appreciate it too. I wasn't sure because we can't do. There could be reasons why we don't act on it. So I just wanted to be clear. We meant that we're evaluating and we're circling back and explaining why it is that we may not act on it, but we value the feedback. Okay. Thank you, sir.
Thank you.
All right. Director Bouquet, does that answer all your questions and comments? Good. Great. Director Williams.
Thank you, Madam Chair. I think also in defining the problem that we need to look at how current and how relevant we are. For example, while I was sitting here, I just went to the RTD mobile ticketing app, and it's very difficult to find information that we have. For example, on our website, we have a GIS map that if you click on the map, you can zoom right down to your house. See your house there? And you can see all the routes that are around you, but you can't get that on the mobile app. And the mobile app is the most current thing that's the people have in their hand when they are looking to use public transit. So why that really, really customer-friendly tool is not available on our mobile app is because we are, a big agency and it takes us time to do things, but we need to be current and we need to look at that kind of stuff. That's part of our problem, I think. Thank you.
Thank you. Director Lewis.
Thank you. Thank you, Madam Chair, and thank you, Director Williams. I wholeheartedly agree. I wanted to go back to the comment from Director Bouquet, and I just wanted to say, in addition to that, that we're mindful about managing our expectations when we're going out to communities, even if we, especially so that we aren't just putting things into a box and doing nothing with it. And what also comes to me, particularly in thinking about marginalized. Sorry, this is my niece here, and she wants to be a part of the RTD board, so she's in training. So you might hear her back here training. Particularly doing with communities and not doing to communities. And I think about marginalized communities in particular, and where are the opportunities for us to put communities in the driver's seat in terms of decision making, right? Where's the autonomy that where are the opportunities to create some autonomy for communities to be able to make decisions because they understand, right, the pain points. They understand the frustrations and might be able to come up with some viable solutions. That concludes my thoughts for real this time.
For the reals?
For the reals.
Thank you, Director Lewis. I don't see anyone else in the queue. The only other thing I would like to kind of build on is what Director Lewis had talked about, the diversity of languages that are now in the Denver metropolitan area are vast. It is no longer just English and Spanish. I know that the third largest population speaking in Denver Public Schools is Mandarin, but my little TMA has been translating in 8 languages along the East Colfax corridor. So I know that there are a lot of languages we need to start honing in on if we're going to do direct customer relationships, particularly with our diverse communities. First, Vice Chair Geisinger.
Thank you. Just really quickly, I think there are a lot of great ideas that go to this, but sort of stating the problem as a big problem, it's bringing back ridership.
Yes.
And the need that we need to address a lot of these things to bring our riders back. That's what we do. Thanks.
Thank you. And Director Rosenthal.
Thank you. I promise this is my last comment.
Okay.
So as Denver does recover, as the country recovers, I think with making sure that with business travelers, with people who are here for conventions, people who are visitors, tourists, day travelers from out of town, that we are also making sure that our system is pretty simple, self-explanatory, and that people are like, oh wow, that was so easy to get around.
Okay, thank you. Director Whitmore.
Sorry, I couldn't help myself. So in looking at what Lynn just said, one of the things that we've heard Deborah say, and I found it fascinating, and that is the process of right-sizing post-pandemic. And if I'm taking the quote out of context, General Manager, please correct me. But I guess my question is, what is right-sizing?
General Manager?
So basically, that's where we are. We're dealing with the ambiguity. And First Chair Geisinger said, bringing back ridership. And this isn't, I'm just talking in generalities and using these topics, so it's not to say anybody's right or wrong. But I'm saying as we talk about all of this is an iterative process, right? So what does it mean to bring back ridership? Is that what we want to do? Just in a general sense, when we talk about the quality of the service versus the quantity of the service. We're dealing in ambiguity right now, right? As we go forward, recognizing that there's employment sites. Some people may be telecommuting. We still have hospitalizations on the rise. So I think as we go through this, I have to say, sitting here listening to the dialogue, and thank you once again to Pauletta Tanilas for capturing this, and I'm reading the comments, I see there's ample opportunity as we go forward. Because let's say hypothetically that, you know, we talk about bring back ridership. There's a myriad in ways of which we can do that, but is that really the, are we identifying certain customer segments? Will that solve whatever our problems are, right? But I think first and foremost, there has to be some groundwork that's done, getting back to the fair equity, the fair study for equity analysis. I heard conversations Director Lewis just mentioned about the different languages. I mean, do you guys know how many languages we actually have that are proficient within our service area? I'll tell you, there's 21. There's 21, what we will qualify as safe harbor languages, which is 5% or 1,000 of the RTD district population. So there are opportunities there that we can leverage going forward. So recognizing that we want to work towards success outcomes, and a lot of these are activity-based, we have to figure out what do we need to eventually define what the problem is that we're solving for, and we're not there yet. This has been great dialogue, but I believe this is the jump off point for us to start to examining all of this, because what do we want our end game to be? And I'm going to steal this from Transpro, but this is spot on when we talk about, you know, sports analogies. You know, I can do all the push-ups I want to do. I can run several miles a day, but the end of the day, if I'm not winning the pennant in the World Series, that was my success outcome, right? So what type of activities do we need to do to get us to the end game, which we're going to qualify as being our success outcome? So Director Whitmore, that was my tap dance around answering the question about right sizing, because I am not in a position right now to offer that up to you. But with some due diligence, with us engaging, with us going to where the customers are, and like Director Lewis said, that is basically leveraging a myriad of different opportunities in which to do, i.e. community-based activities, different events that are had, and we can basically engage on those levels. You know, we can basically discern what that might be. And I would garner to say within, you know, the next month or so, well, let me not say it like that. We can work in earnest to develop some kind of baselines that help us address some of these questions by going to where the people are. So we're better engaged and have a better conversation and work towards a solution to the actual problem that will come in time as we define it. Thank you.
Thank you. Are you good, Director Whitmore? Okay, great. There is no one else in the queue, Madam General Manager. So I think the next slide is next steps, and I'm going to turn it back over to you.
Yes, and I would say next steps, because we did some ideating, but getting back to what Director Deschelle said, we were being organic in our process, which I think was very helpful. I hope it was helpful for you all as we look at different elements in which we can explore, so we can hone in on what it is that we need to do. So what I plan to do with my team and pull in, and when I say the team, I think it's paramount as well that we leverage our partners with Transpro, and recognizing you all are going to have an engagement with them in short order next week. As we talk about assessing ideas and concepts, we have to do it from a fact-based vantage point. And I think if we have a common set of facts as we go forward, and those facts will come from our customer segments with whom we endeavor to engage, it will enable us to go forward. So what I would say to you, recognizing where we ended up this evening, it's taking in that information, charting out a path forward. And what I'll do is make a commitment to you all to keep apprised, because I am going to work with my team over the next week or two, more realistically, like within the next 2 weeks, to sort out all these different elements that we have and keep you all engaged and put forth an earnest effort to discern what our steps will be. Because I think if anything, we have to have an understanding of what the customer pain points are, and we have to go out and do that. And some of these elements that you all have brought full circle gives us the right ideas in which we need to explore relative to having a better understanding. Does that make sense to everyone? And I'm happy to clarify, because like I said, it seems as if I'm talking in circles because I can't speak in absolute.
No, I think you captured it. I'm seeing no comments from other directors. So thank you so much. This was an amazing presentation. And I look forward to learning more. And I want to thank the board for their insight and their thoughts regarding this. I think that this is launching off how exciting our strategic plan is going to be. And I'm really looking forward to that. So with that in mind, that is now concluded. Are there any other matters to come before the board this evening?
I have a question. I guess I thought we were going to ideate solutions. Are we doing that some other time? Is that?
Well, Director Geisinger, I thought I'm open to it if you guys want to ideate, but what I'm saying is in reference to us looking at where we are, there's some things that we need to do, but if you want to offer that up, I'm more than amenable to that, if that's the pleasure of the board. But I was saying in reference to some of the things that put forth, there were ideas that came out how to solve a problem, but we haven't clearly defined what the problem is.
What's your pleasure, First Vice Chair?
Well, I have some ideas, but I guess I'd like to see what other people have to say. I sort of was trying to just, address the problem and the ideas. What do others think?
Okay. Anybody else want to pitch in? Director Tisdale.
Yeah, thank you, Madam Chair. I appreciate that. At the risk of repetition, the concern that I have is I think it's great, and I think we can brainstorm. I don't know if it will be a satisfactory or a fulfilling process by doing so without having some better definition of the problem. I would, for example, in terms of ideation, I would offer that, I think it was your comment, Madam Chair, that first and last mile solutions are the most critical thing that we can address. And we've been talking about that since transportation began. When people rode stagecoaches, they wondered once they got to the city, how were they going to get to where they were going? And probably the man who invented the wheel, or the person who invented the wheel, had the same problem in trying to figure out, okay, it's going to get me from here to there, but what if somebody wants to go someplace else? So in terms of ideation relative to potential solutions, I think they must all be framed on first and last mile. And as you have said, partnering, as we have done, with people like Uber and Lyft and the other TNCs is one part of that. Bicycles, as Director Rosenthal points out, is another part of that. The list goes on. But I think clearly that's going to shape and form a lot of what we're going to do. So I have no opposition to talking about solutions, but I think it might not be as productive until we have a better sense of what do we think the problem is, which I think we will be able to speak to better once we've had some further empathizing with our customers, our operators, and our stakeholders. Thank you, Madam Chair.
Thank you, sir. Second Vice Chair Cook.
I saw a bunch of hands. I don't want to jump in line here.
No, you're the first one that came up for me.
Oh, sorry. So General Manager Johnson, will you then bring back the problem statement and allow for some of the brainstorming in the ideate phase that we're talking about here? Is that the idea?
Yes, Director Cook, that would be the idea, recognizing that we do need to hear from our customers. But as I said before, I'm totally amenable as we are in this together and recognizing you guys have an understanding of your constituents, and I have engaged with our customers. I think we could both benefit from the engagement.
Thank you. First Vice Chair Geisinger.
I'm listening for now.
Okay.
Back to me.
Director Bouquet.
Thank you very much, Madam Chair. I just wanted to kind of check real quick. You don't have to put this note down. If what is being said is representative of what the board members who have not spoken so far, is this what is kind of capturing? That's just, I would want to kind of bring it up if for the board members who have not spoken yet, you know, is this really capturing what you were thinking? And just want to make sure they all had an opportunity to speak. Thank you.
Thank you. Director Williams.
Thank you, Madam Chair. I'm also fine with waiting until General Manager Johnson and her staff massage the work that we've done so far, and then bring that back to us so we can work from that. And then I have two other things that are under other matters. So after we close this out, would you call on me again?
Okay, will do. Secretary Busick.
Thanks, Madam Chair. Yeah, I would agree with refining the problem statements, seeking some more input from wherever and coming back. But I'd love for us to get study session 2 on the calendar as soon as possible so it doesn't get away from us. Thanks.
Duly noted. Director Sloan.
Yeah, I would just like to state in a future meeting, I would appreciate a time frame or a definition given to recovery, because the word recovery itself just means back to where we were and not, you know, a future improvement. So I would be appreciative of how we should look at that and how long we think it will take.
Okay, thank you so much. Director Lewis.
Oh, sorry, I was on mute. I am okay with handing this over to General Manager Johnson and following her process and her protocol. And coming back once more information is collected and letting us know what that timeline might look like. And I agree with Director Busick and Director Sloan actually, that it'd be helpful to get these things on our calendar and definitely being able to define some of these terms like recovery.
All right, thank you. Director Deschelle.
Thank you so much. And thank you, General Manager Johnson and Madam Chair, for guiding us through this. I just want to be really mindful of the sort of delineation between policy and management as a board. And while I appreciate and love design thinking and love this process, I want to make sure that we are not getting too into where I believe staff should be doing this process with constituents versus which items board should be doing and ideating and prototyping. And so hopefully, I assume that's what we're going to be doing with our strategic consultants. I apologize if I did misproperly name those on the phone, but I just want to really keep that in mind as we move forward, because a lot of these, to me, sound like management, staff, ideation, iteration, and not as much board.
Thank you. Director Broom.
Thank you, Madam Chair. I've been listening all evening to the various ideas, and some things stick. Like somebody said, people are willing to get on an airplane and sit shoulder to shoulder for 3 or 4 hours to get from point A to point B, but they're reluctant to get on a bus or a train. I guess what comes to my mind as an organization, RTD, what are we doing with ourselves and our employees to improve ridership? The way we're operating right now on Zoom just doesn't lend itself to this type of long-term planning. I mean, we don't know each other. We can't talk to each other, you know, informally and build on some ideas. We just have to throw things out and hope that they stick somewhere along the line. So somewhere we've got to decide when we're going to start as an organization, really meeting, you know, in person and getting back to normal. Thank you.
Thank you. And General Manager, if I might ask you what the thought is currently in terms of in-person meeting. I mean, I know you're really mandated by the CDC and stuff, but can you add any clarity right now where you're at?
Yes, I can, Madam Chair. And once again, I will share where we are currently, recognizing that we have increase in COVID cases, recognizing that we do have confined space as it relates to the meeting space for this board of directors. We are treading lightly as it relates to that, recognizing that we have to ensure that the meetings are publicly accessible. We do not anticipate being back in person as it stands here at the point in time on April 26th at 7:16 p.m. anytime prior to July at the earliest, but more specifically, we were looking towards September. Recognizing that the cases are extremely high and that meeting room that we currently utilize would not enable us even to distance at 3 feet apart. And so that causes grave concern as we look at the health and well-being for all people assembled. So as I shared at the outset of my comments this evening, that we will keep you apprised, and I will ensure that you all are made aware of any decisions prior to them happening relative to us coming back in person. There are several different things as we talk about, ventilation, how, people coming into the building and what those protocols will be. We do have a COVID-19 matrix with various phases, and, we're just embarking upon phase 2. And phase 3 would clearly enable us to bring people back, but we have to look at the capacity limitations. And so that's really where we are.
All right, thank you. Thank you, General Manager.
You're
I
welcome.
see your hand up, Secretary Busick. Did you have an additional comment? No. Okay. Anyone else have any comments? So first Vice Chair Geisinger, if I read right what everybody was saying, the majority was like, let's wait and get something back once the general manager takes this information and starts developing her plan of action and then bringing it back to the board. Do you concur with that?
I'm totally fine with that. Yeah, looking through the packet, I thought we were going to spend some time doing that, and but I think that that taking it back to staff to go through this and sort of pull it apart and move us to the next step and bring it back to us to kick around ideas sounds like a great way to proceed. Thanks.
Thank you, First Vice Chair Geisinger. Again, I want to just say thank you to the board. This has been really great dialogue, and I was taking copious notes as well, so I want to thank you for that. So with that aside, we're now at other matters, and Director Williams, you said you had a couple of other matters to bring before the board this evening.
I do. Thank you, Madam Chair. The first thing I want to do is I want to thank all of the previous RTD board directors who sent a letter in support of the agency and the future of the agency. Both of my predecessors signed off on that. And so I just wanted to thank everybody who took the time to take a look at where we are, where we've been, and where we're going. And then in relationship to working with kids, I just want us to remember that Denver Public Schools is in the middle of going through what we went through. They are about to hire a new superintendent, and hopefully they'll get somebody as great in this as we did. Deborah, you don't happen to have a sister that wants to work at the school district, do you? And once that has happened, they would be a good partner to work with in some of the things we talked about earlier. And thank you, Madam Chair. That's all I have.
All right, thank you. Any other board members? Ooh, okie dokie. Second Vice Chair Cook.
Yeah, Madam Chair, and forgive me for not raising this in the prior session. I'm just kind of a plotter when it comes to thinking. I respect what Director Deschelle said, but I think we didn't quite get a handle on what, say, we're trying to solve as a problem to just turn it over to the staff. So I just wanted to underscore the point that I'm hoping they come back to us with a good problem statement, maybe some ideas about the way they plan to move forward, but not having the plan itself at that point. I'm just hoping for a closer, kind of in keeping with what Director Busick said, a study session that we set up sooner. Thank you.
Thank you. Yes, General Manager.
Yes, so if I may, I think if anything, just for clarity's sake, basically when we talk about the problem statement, we need to ensure that we go out and statistically validate what the issue is we're solving for. So relative to talking with customers in the community, we will garner a better understanding. Then I can bring that back because it'll be fact-based. And then we'll have an understanding of what we're trying to problem solve for. So I just wanted to clarify that. And then additionally to Director Sloan's question, at the beginning of the presentation, that's why I asked the question as it related to recovery. How would you qualify recovery, right? Because we all need to have that common definition as we move forward. So we can work towards that as well, but keeping in mind that we need to statistically validate what the issue we're trying to solve for, as opposed to just speaking in ambiguity. So that's what I will endeavor to do, and outline a timeline for all of you so you can garner a better understanding about the path forward. Thank you, Madam Chair.
Thank you. First Vice Chair Geisinger.
Thank you. Just a quick update on a couple of bills today. The Accountability Committee bill on the RTD statute with the 4 changes was up in the Senate Energy and Transportation and Energy Committee today. I testified as to the board's support for House Bill 1186, which is that bill, and it passed out of committee on a 6-1 vote. It will go to the whole Senate next. So it had good support. And then after that, and I wasn't able to stay and listen to all of it, but the Front Range Passenger Rail bill also passed out of committee, and as I understand it, will go to the Senate. Thanks.
Thank you. Director Deschelle.
Thank you so much, Madam Chair. Just a couple notes. The first is the Reimagine Committee is meeting in May, I believe is our next meeting. Happy to send out materials as I get them to the extent anyone has input that they think should be shared with the Reimagine Committee. The next is that May is Mental Health Awareness Month. As someone who struggles with anxiety and depression, I'm proud to say that I do see a therapist. I know that RTD offers EAP services that covers some of our employees' costs for seeing services. And as we emerge or don't emerge, or however we get through over a year of the pandemic, I hope that people are seeking the support that they need and know that you are not alone out there if you are having a tough time.
Thank you. Secretary Busick.
I'm sorry, is my hand still up? I didn't have anything.
Yeah.
Sorry.
Okay. Director Lewis, your hand is up.
Thank you, Madam Chair. So Director Deschelle beat me to it, and I appreciate that he did, because I'm just going to continue to encourage us all to see our therapists as often as we might need to, understanding that globally there's just a lot happening in this world. And so I just want to make sure that we're all taking care of ourselves, taking care of our spirits, and taking care of ourselves emotionally, and then celebrating Director Deschelle for his recent appointment with his mental health provider. So good job, Director Deschelle.
Thank you. I would like to thank our staff, our team, for putting on a great 5-year anniversary event of the A-Line this morning. And I'd like to thank Director Broom, Deschelle, Sloan, Tisdale, First Vice Chair Geisinger, and Second Vice Chair Cook for joining me at the A-Line. It was a great event, and Denver Transit Partners did a great job, and operators. They were fabulous to go down to the station, their building, to see, the operations room. It was quite fascinating, but it really was a great celebration. Mayor Kaufman from Aurora, Mayor Hancock from Denver, Kim Day from Denver International Airport, and our Denver Transit Partners all came together with our general manager and the board to celebrate this momentous occasion. And one of the tidbits that came across is that the A-Line was the most used service in the country, even during the pandemic. And so that was pretty exciting news to hear. But any of you, so all of you, Director Tisdale was there as well as Geisinger. We really had a good time, so thank you for being there. Any other matters to come before the board? Okay, seeing none, it is 7:26 p.m. and I'd like to call for an adjournment. Is there anyone opposed to adjourning? Hearing none, we are adjourned. Have a good evening, everybody. Enjoy.
Bye, everybody. Good job.
Thank you.
Bye.